taking care of a new heart comes with lots of responsibilities for the entire family. While the Children's of Alabama Pediatric Heart Transplant Team will continue caring for your child after surgery, success depends largely on the care you and others give at home. During the recovery phase, members of the transplant team will meet with you and your family to teach you how to take care of your child's new heart. You will learn about medications, diet and exercise, follow-up visits, potential complications, special precautions, and transition to adult care. The transplant pharmacist will teach you and your child about the medications he or she will take and will show you how and when to administer them. It's very important to know and understand the purpose of all the medications. You need to learn the name, dosage, and time that the medication is taken. The pharmacist will provide a medication list to help you keep track of this information. Your transplant team will monitor your child's medications very closely and will adjust them as needed. Be sure to record all changes on the medication list. Always bring this list and all the medication bottles to clinic or hospital visits. To keep the new heart healthy and working properly, your child's immune system must stay at a low level to prevent rejection. This is done by taking medications called immunosuppressants. It's important to take them exactly as prescribed to maintain a good balance. Too little medication will allow rejection to occur in the new heart. Taking too much will alter the body's ability to fight infection and can cause other complications. Your transplant team will monitor levels of these medications in your child's blood and adjust the doses to maintain this balance. Before your child takes anything that has not been prescribed by the transplant team, including any over-the-counter medicines, be sure to contact your transplant team because there are some drugs that should not be taken after transplant. These include, but are not limited to, NSAIDs, which are non-steroidal anti-inflammatory drugs such as ibuprofen, naproxen sodium, Aleve, Motrin, and Advil. These drugs have the potential to cause kidney damage when taken with immunosuppressants. Be aware that certain antibiotics and other prescription medicines may interact with anti-rejection drugs and are not allowed. And neither are herbal and homeopathic remedies and medications. The bottom line is this: if it hasn't been prescribed by your transplant team, don't use it without checking with the team first. Now let's talk about diet and exercise. Eating a well-balanced, heart-healthy diet after transplant is good for the patient as well as the whole family. A nutritionist or dietitian will evaluate your child and provide individual diet recommendations. Getting regular exercise after transplant is very important for your child's mental health and physical well-being. Participating in developmentally appropriate activities that your child can do at their own pace should be encouraged. Your transplant team will provide guidelines for physical activities and restrictions. Be sure to consult your transplant team before your child engages in competitive or contact sports. Next, let's discuss follow-up appointments with the transplant team. These are very important. Before your child leaves the hospital, you'll be given a list of appointments that will include clinic visits, lab tests, echocardiograms, heart biopsies, and other tests. The purpose of these visits is to monitor your child's progress and to identify complications as early as possible. These appointments will be very frequent during the first 6 months to 1 year after transplant, and then will generally become less frequent over time as your child adjusts to the new heart and post-transplant routine. Now that you've learned a little about how to care for a new heart, let's talk about some potential complications that could happen after transplant. Since your child was not born with the new heart they've received, their body may see it as something foreign and may try to attack it. This is called rejection. Most people who have had heart transplants have some level of rejection after transplant, so we need to talk about what to look for. Symptoms of rejection can include shortness of breath, fever, irritability, fatigue, nausea, vomiting, diarrhea, swelling, and change in heart rate. Stay in close contact with the transplant team so you can report any symptoms as soon as they occur. The transplant team monitors for rejection in several ways. Blood work will be done frequently to make sure anti-rejection medications are at the correct dose and that the heart and other organs are working properly. Echoes will be done to look at the function and movement of the heart. Biopsies will be performed with catheterizations. During these procedures, the physician will examine the pressures in the heart, and a tiny piece of heart tissue will be removed and examined for signs of rejection. Rejection can be mild, moderate, or severe. It can almost always be reversed if treated promptly. Depending on the severity, treatment for rejection may include anti-rejection medication adjustments, additional oral or IV medications, and other treatments. Your child may have to come to the heart transplant clinic more often and have blood work done more often after a rejection is treated so the transplant team can make sure that your child stays well. The best way to prevent rejection is to take medications exactly as instructed at the same times every day. Also, be sure to come to all scheduled clinic, lab work, and biopsy appointments. If your child is unable to take medications due to nausea or vomiting, or misses any medication doses, call your transplant team as soon as possible. Some of the medications that your child takes will weaken the immune system and create a greater risk for getting sick. Infections can be caused by bacteria, viruses, parasites, and fungi. Here's how you can help ward off infections. Wash hands often, before eating, after going to the bathroom, after coughing and sneezing, and before and after changing bandages. Good hand hygiene is the best way to prevent infection. While recovering from the transplant surgery, your transplant team will ask your child to wear a mask anytime he or she leaves the hospital room, even in the hallways, and anytime in public for a certain period of time. It might be necessary to wear a mask in public during the cold and flu season. Your transplant team will educate you on when and where your child should wear a mask. Your child should stay away from people with colds and other infections. Your child should not handle animal waste and should avoid contact with animals that roam outside, and should not clean bird cages, fish tanks, reptile cages, or cat litter boxes. There are certain animals that are not safe for transplant patients to keep as pets. Your transplant team will educate you on which pets to avoid. Your child should not get vaccines that contain live viruses, such as oral polio, measles, mumps, German measles, yellow fever, smallpox, chickenpox, and flu mist. If your child or any other family member needs to receive any vaccinations, contact your transplant team before they are given. When returning to school or daycare, you'll need to ask the people who work there to call you immediately if there are any communicable diseases such as measles, chickenpox, and flu going around. They'll also need to inform you if there will be any immunizations given in school, such as flu mist. To avoid exposure, your child will have to avoid school or daycare until instructed by the transplant team. Be aware of food safety precautions when cleaning and cooking fruits, vegetables, meat, eggs, and dairy products. There are also foods that transplant patients need to avoid eating. Your transplant team will educate you on food safety precautions and which foods to avoid. Good dental care is very important. Your child should brush and floss teeth daily and visit the dentist regularly. Your child will need an antibiotic before routine dental visits. Contact your transplant team for this medication. Your child should avoid exposure to mold, mildew, or other organisms that can cause infection, and should avoid buildings under construction or destruction and homes undergoing remodeling. Pathogens that can cause infection can become airborne during construction, destruction, and remodeling. And finally, your child should take special precautions when getting tattoos or piercings. Please contact your transplant team before getting these. Be on the lookout for signs and symptoms of infection that can include fever, a productive cough, nasal drainage, nausea, vomiting, diarrhea, drainage or swelling from a wound, sore throat, ear pain, and burning or difficulty urinating. Report any symptoms of infection or any exposure that your child has had to people with infections like the flu, chickenpox, shingles, mumps, measles, and tuberculosis to the transplant team as soon as possible. Your team will educate you on other potential complications that can occur after transplant, such as kidney insufficiency or failure, coronary vasculopathy, post-transplant lymphoproliferative disorder or PTLD, hypertension, osteoporosis, diabetes, anxiety, or depression. There are a few other precautions to be aware of. Children who have undergone heart transplant need to take precautions when being exposed to the sun. They also need to avoid exposure to smoke and secondhand smoke, alcoholic beverages, and illicit drugs. Transplant recipients must take precautions when engaging in sexual activity, and female transplant recipients should avoid becoming pregnant. Your transplant team will educate you on these topics and other special considerations to maintain a healthy heart transplant. Our last area of discussion has to do with making the move from pediatric care to adult care. The goal of the heart transplantation is to improve the quality of life for children with heart disease and extend long-term survival well into adulthood. Our wish is that young adults who have received heart transplants have the opportunity to reach their goals and live a happy, productive life. Just as families must spend a lot of time tending to their child's heart transplant care, the transition to adulthood will also require extra effort and energy. The journey to adulthood for children who have had a heart transplant is filled with joys and challenges, just as it is for any child with a chronic health condition. It's a time that many changes will take place physically, socially, and emotionally. Healthcare needs also change for the young adult, and age-appropriate medical treatment is needed to maintain the best health after heart transplant. The pediatric heart transplant team at Children's of Alabama recognizes this need and believes that families and children who have had heart transplants need education, preparation, and support as they transition from children's to an adult heart transplant center. And we're committed to helping all of our patients do this successfully. You've received a tremendous amount of information in this video program. If you need guidance or have any questions, just remember, we're here for you. Please contact your transplant coordinator for more information, or if there is anything we can do to help make this incredible journey easier for your child and your family.